Hi, doctor friends. Today's topic is the drug of choice, part second. It is most important topic and all-time hits topic for NEET PG, DNB, and on AIIMS PE and FMGE and other type of PG exam. So make a note and revise daily so that you can't miss the question. Let's start with Raynaud's phenomenon. The drug of choice will be calcium channel blocker like nifedipine or amlodipine. The essential tremor. Drug of choice is propranolol. Sorry, propranolol. And akathisia. The drug of choice, propranolol. HOCM. Hypertrophic obstructive cardiomyopathy. Drug of choice, propranolol. If there is beta blocker poisoning, due to propranolol is beta blocker, so if beta blocker poisoning, then glucagon is the drug of choice. Next one is the BPH, benign prostatic hypertrophy. Here, benign prostatic hyperplasia. The treatment of choice, if without hypertension, that is tamsulosin, while that of with hypertension, it will be the prazosin or doxazocin. Here the performance anxiety, then drug of choice will be propranolol. Performance anxiety, that means when anyone want to do something like signature, like writing something, then the trembling in the hand and doing any work with hesitation, it is called as performance anxiety. The drug of choice will be propranolol. Migraine. Migraine, it is acute, mild to moderate migraine. Then it is NSAID will be the drug of choice. If acute severe migraine, then sumatriptan. Here the acute word you have to remember, acute and severe. There is sumatriptan. But in case of prophylaxis, there is propranolol. I will upload the other video about the migraine. So the drug about migraine mentioned in that person. Here the abortion within the 7 week, then it is mifepristone and misoprostol will be the drug of choice. Induction of the liver, it is oxytocin, while that of PPH, postpartum hemorrhage, the drug of choice will be oxytocin. Cervical priming, that is misoprostol. Cervical priming. Cervical priming is a situation, that means during the diagnostic dilatation and curation of cervix, there is difficulty in the dilation, and this study was evaluated the effect of vaginal misoprostol for the priming condition before the diagnostic dilation and curation. Next one is the NSAID induced peptic ulcer. Then it will be the PPI, proton pump inhibitor, will be the drug of choice. Open angle glaucoma. Open angle glaucoma, then latanoprost is the drug of choice. To maintain the patency of the ductus arteriosus, it will be the alprostadil. Alprostadil. You have to remember. Alprostadil start with A, then artery. Prost, that means P, start with patent. Ductus arteriosus. D for ductus. You have to remember A, P and D. Artery, patent, ductus. Next one is the treatment of the PDA. Then it will be the indomethacin. And Bartle syndrome, the drug of choice will be indomethacin. Pulmonary hypertension, the drug of choice will be the oral diltiazem or amlodipine or nifedipine. Rheumatoid arthritis, the pain relief, the drug of choice will be NSAID. And rheumatoid arthritis with bridge therapy, it is corticosteroid. And rheumatoid arthritis with DMARD, it will be the methotrexate drug of choice. You have to remember DMARD, methotrexate. Next one is flushing due to nicotinic acid. The drug of choice will be aspirin. Prophylaxis of MI and a stroke, the drug of choice will be aspirin. Anaphylactic shock, this is the adrenaline drug of choice. Acute Mediterranean fever, then drug of choice will be the colchicine. The cancer chemotherapy induced vomiting, it is the ondansetron. This question asked in the NEET PG 2019, and it is also asked that the ondansetron acts on the 5-HT3 antagonist. That means it is 5-hydroxytryptamine antagonist. Next one is cisplatin induced vomiting. If early case, then ondansetron, and delayed, it will be the aprepitant. Aprepitant is the neurokinin first antagonist. Neurokinin 1 antagonist. Aprepitant, fosaprepitant is the other drugs. Next one is the gout. Gout, in case of acute, the drug of choice will be NSAID, except aspirin. Refractory acute, that means drug of choice will be the colchicine. In case of gout with chronic gout, that means allopurinol will be the drug of choice. Here the another question asks that the chronic patient of the gout who are allergic to allopurinol, then febuxostate will be the drug of choice. Hyperuricemia, secondary to anti-cancer drug. Hyperuricemia, that then the drug of choice will be allopurinol. Next one is the diabetic nephropathy. The ACE inhibitor or ARB inhibitor is the drug of choice for the diabetic nephropathy. Scleroderma hypertensive crisis. Here the word is scleroderma hypertensive crisis. Then captopril is the drug of choice. Next is the congenital heart failure. Decompensated patient. That means CHF with decompensated. Then dobutamide, dobutamine is the drug of choice, while that of incompensated patient, the ACE inhibitor is the and ARB is the drug of choice. HOCM, the drug of choice will be propranolol. Angina pectoris, acute case, it is the nitroglycerin. Sublingual will be the drug of choice. Prophylaxis case, nitrates. Oral or transdermal will be the drug of choice. Next one is the oesophageal spasm. Oesophageal spasm, the drug of choice will be the nitroglycerin. If cyanide poisoning, then hydroxycobalamin or amyl nitrate will be the drug of choice. Raynaud's phenomena, already told, nifedipine or amlodipine will be the drug of choice. Myocardial infarction, for the pain relief, it will be the sublingual nitrate or morphine will be the drug of choice. The prophylaxis, aspirin will be the drug of choice. Thrombolytic for STEMI, ST elevation MI, then retiplase or altiplase will be the drug of choice. Next one is the hypertension. Hypertension, the hypertension with BPH. If hypertension, then drug of choice will be thiazide. With hypertension, prazosin. With diabetes mellitus, it will be the AC inhibitor. If hypertension with angina, ischemic heart disease, then beta blocker will be the drug of choice. If hypertension with chronic kidney disease, it will be the AC inhibitor, will be the drug of choice. In the pregnancy case, hypertension in the pregnancy case, labetalol or alpha methyl dopa, both are written in the different book. Somewhere alpha methyl dopa is written and somewhere labetalol. So if anyone option will be given in the objective, then you choose which one is correct. If both are given, alpha methyl dopa. Next one is the acute severe digitalis toxicity. Here the digitalis toxicity, dizibind will be the drug of choice. Hypertensive emergencies, the esmolol plus nicardipine will be the drug of choice. Hypertensive emergencies in cheese reaction, then phentolamine will be the drug of choice. And hypertensive emergencies, clonidine withdrawal. With clonidine withdrawal, here the phentolamine will be the drug of choice. Hypertensive emergencies. Aortic dissection, that means hypertensive emergencies with aortic disease, nitroprusside plus esmolol will be the drug of choice. Hypertensive emergencies with pregnancy, labetalol will be the drug of choice. Next one is the hyperlipidemia. Hyperlipidemia type 2A and 2B. The drug of choice will be a statin. Type 3rd, also known as hypertriglyceridemia. Drug of choice fibrates. Type 5, drug of choice statin. Next one is the then the hyperlipidemia secondary to diabetes or nephrotic syndrome. The drug of choice will be the statin. So you have to remember fibrates and the type 3rd. Next one is the supraventricular tachycardia. Supraventricular. In case of narrow QRS complex, then verapamil or beta blocker will be the drug of choice. In case of supraventricular tachycardia with wide complex, then flecainide will be the drug of choice. And the supraventricular tachycardia with Wolff-Parkinson-White syndrome, here the flecainide will be the drug of choice. Here the PSVT in case of acute treatment, the adenosine will be the drug of choice. Next one is the PSVT for the prophylaxis. Drug of choice will be the verapamil. The ventricular tachycardia, lignocaine will be the drug of choice, and digitalis induced. That means ventricular tachycardia which are digitalis induced, the lignocaine, in both cases lignocaine will be the drug of choice. So the point is the drug of choice will be the magnesium or magnesium sulfate. Long QRS syndrome, long QT syndrome, the drug of choice will be the magnesium. In case of the edema due to CHF, the drug of choice will be the furosemide. The edema with renal disease or nephrotic syndrome, then drug of choice also that furosemide. And the edema with, that means pulmonary edema, the drug of choice will be also furosemide. And cerebral edema, mannitol will be the drug of choice. And due to cirrhosis, edema due to cirrhosis, the drug of choice will be the spironolactone. The diabetes insipidus, in case of the central diabetes insipidus, the desmopressin will be the drug of choice, while that of the nephrogenic diabetes insipidus, thiazide will be the drug of choice. Lithium induced diabetes insipidus, amiloride will be the drug of choice. Next one is the recurrent calcium storm. The drug of choice will be the thiazide due to hypercalciuria. The acute mountain sickness, the drug of choice will be the acetazolamide. The nocturnal enuresis, desmopressin will be the drug of choice. SIADH, the drug of choice will be the first fluid restriction, then hypertonic saline, then furosemide. So all three are drug of choice, but main drug of choice will be furosemide and hypertonic saline. Next one is the about the infantile spasm. The ACTH will be the drug of choice. Hypothyroidism, then L-thyroxine will be the drug of choice. Myxedema coma, the L-thyroxine will be the drug of choice. In case of hyperthyroidism, with in the lactating female, the propylthiouracil will be the drug of choice, and also in the first trimester, propylthiouracil will be the drug of choice, and second and third trimester, the carbimazole or methimazole will be the drug of choice. With hyperthyroidism, with grapes ophthalmopathy, then methylprednisolone will be the drug of choice. Next one is the thyroid storm, is the propranolol drug of choice plus iodine. Propranolol, also known here as life-saving drug. The diabetes mellitus. Type 1 is the insulin, and type 2 the metformin will be the drug of choice. In case of obese person, the metformin will be the drug of choice, while that of the uncontrolled diabetes, then here the type 2 with uncontrolled diabetes, insulin will be the drug of choice. In case of type 2 diabetes mellitus in the pregnancy, then also insulin will be the drug of choice. And to tide over stress, then also insulin will be the drug of choice. The diabetic ketoacidosis, the drug of choice will be the insulin, which are regular. The postprandial hyperglycemia, then nitiglinide will be the drug of choice. The acute hyperkalemia, the drug of choice will be the calcium gluconate. And the beta blocker poisoning, already told, glucagon. Adrenal insufficiency, in acute cases, hydrocortisone will be the drug of choice, while that of the in chronic adrenal insufficiency and Addison disease, hydrocortisone will be the drug of choice. The next one is the contraceptive. The newly married female, the contraceptive of choice will be the combined OCP, and in lactating, the mini pills will be the drug of choice, and contraceptive in emergency, levonorgestrel will be the drug of choice. Next one is the ovulatory infertility. The clomiphene will be the drug of choice. Next one is the osteoporosis. Postmenopausal osteoporosis, the alendronate will be the drug of choice. And steroid induced, then alendronate already. The women with a risk factor of the breast cancer in the osteoporotic female, then raloxifene will be the drug of choice. And the hypercalcemia of the malignancy, then biphosphonate will be the drug of choice. The Paget's disease of bone, then biphosphonate will be the drug of choice. Tetany, the calcium will be the drug of choice. Induction of the liver, oxytocin. PPH, oxytocin already told. The acromegaly, the cabergoline will be the drug of choice. Osteophyseal varices, terlipressin will be the drug of choice. If not available, octreotide. Then osteophyseal varices, octreoids will be the drug of choice. If not available, terlipressin will be the drug of choice. Hyperprolactinemia, cabergoline will be the drug of choice. androgenital alopecia will finasteride will be the drug of choice. In case of DUB, light bleeding, medroxyprogesterone acetate will be the drug of choice. In heavy bleeding, the combined OCP will be the drug of choice. Intractable bleeding, then leuprolide will be the drug of choice. Endometriosis, combined OCP, and ectopic pregnancy, methotrexate will be the drug of choice. Thanks friend for watching my video and for your kind information and your support. My all video are giving you more than 35 questions in the NEET PG 2019. So must watch my video till last so that can't miss the question in your medical PG. So thanks for watching my video. Have a nice day.